Now, let me just tell you a little bit about Laura Punnett, who is going to start off the action here with some information about COVID. She is a mentor of mine. I've known her for 30 years. I'm at UMass Lowell, where I'm a grant-funded occupational health researcher, and she is a professor of ergonomics and epidemiology. She's held status at UMass Lowell as a university professor, which is the highest honor that you can hold there. And more importantly, I think for all of us right now, is that she has a great handle on the language and turning complicated technical issues into ideas that can move. So that's all I need to say, and I'll let her take it from here. Go ahead, Laura. Thank you.
Thank you very much, Scott, for that kind introduction. You forgot to say that I'm a proud MTA member as well. So we're here dealing with a novel virus, but we have well-established scientific principles that still apply. This information is not novel. For someone to become infected with a pathogen, a virus or a bacteria or anything else you might consider a germ, there has to be a sufficient amount of the pathogen to cause an infection in the body, and it has to be live. It has to be able to cause disease. That's what we refer to as the source of the infection. And then it has to have a way to get into the person, which sometimes in the scientific jargon is labeled as a host or a receiver. That pathway to the body from the source to the person we'll refer to as the path or the route of transmission. And then the person has to be susceptible to infection. So the dose that is of this infectious agent is the amount, in this case of a virus, the amount that's present and on a pathway to us, and the amount of time that we're exposed. So that determines how much of it actually gets into our body. If we can keep that total amount low, below what the immune system can handle, then you might be exposed but not actually get sick. We are pretty much all susceptible, as far as we know, to the COVID-19. It's actually quite lethal in the human population, but it does seem that some people may have more susceptibility to others, and that's one of the many scientific questions that's still being examined. Next slide, please. So I mentioned the idea of the route of transmission, or the pathway. So there are three main pathways that we should be thinking about when we think about possible exposures to the virus, whether at work or outside the workplace. One is physical contact, that is droplets or contaminated material that you make contact with. So this is why we're paying so much attention to hand washing, for example, because if you touch something that's contaminated, especially if you put it at your eyes or your mouth, that's a route of transmission to your body. Then there are large droplets that can be propelled into the air and land on your face or mucous membranes. These don't travel terribly far because they're big. They can contain a lot of viral material. And then there are the really tiny, tiny particles that are also expelled when we talk or cough or sneeze or sing. They can travel much farther in the air. They can be suspended for even hours, at least in laboratory settings. It's been documented that these nanoscopic particles can be still circulating in the air many hours later. And they can be inhaled, therefore, even if you're quite far from the person who produced them. So next slide. This is not a very appealing picture, but this illustrates really well the large drop. This person is sneezing or coughing, and we can see the large droplets which are falling down from the person. They're arcing downward towards the floor. They don't travel very far. but they do contain a lot of material. We also see a cloud rising upward from the person's mouth. These are the very, very tiny particles which disperse and can remain in the air. Droplets are produced, both droplets and the very fine particles are produced in all sorts of normal activities like speaking and coughing. These produce particles of all sizes. And another complication is that the larger particles, because they contain a lot of moisture, the moisture evaporates, so those particles become smaller and therefore might even increase the concentration of tiny particles in the air. Also, as we can see, the concentrations are highest in the vicinity of the source, right? So if you're up close to that person, you're going to get a bigger dose. But it's a continuous function. It doesn't suddenly drop. There's no magic number at which all of a sudden it all disappears from the air, and especially not for the tiny particles. The smaller they are, the longer they can remain floating in the air, and the farther they can travel from the speaker. Next slide, please. So when we think about these routes of transmission, we're still not really certain what percentage of cases are caused by each of these three routes of transmission. So I've put some notes here about what's considered important. Important to an epidemiologist means what proportion of cases are caused by it. So it seems that most people are actually thinking now that direct physical contact is not the primary is not a big way that the virus is being transmitted from one person to another. That doesn't mean we should stop hand washing, but it does seem as though most of the cases are happening either because of droplets or aerosols, the nanoscopic particles in the air. While the scientific research is going on this question, we should be trying our best to prevent all three of these. They don't cancel each other out. This is a really terrible virus. We don't want to be taking risks by saying, well, we're just going to focus on one and ignore the other two. We should be applying the precautionary principle, which says that in the absence of scientific certainty, we should take extra precautions to try to prevent any disease. I mention here about the CDC saying that aerosols are unimportant because it's unfortunately a political obstacle in some situations to getting the level of prevention that we need, because what the CDC says is then picked up by the states, and that's picked up by the governors, and that's passed down to state agencies. And so if aerosol transmission is not getting attention at a national level, and actually it's been downplayed by the World Health Organization as well, then that means that we need to put some extra effort into making sure that the scientific evidence about the importance of aerosols gets full attention. Next slide, please. So in a nutshell, where is the risk high? When you're inside an enclosed space like a building, especially if there are a lot of people there breathing out into the air and where there's not good air circulation. So that's why we're seeing people gathering outside, still with distance between them, but gathering outside because you have inherently a lot of what we call dilution ventilation. You have a lot of air, so whatever people exhale gets spread around very quickly, disseminates, and the possibility of any one person getting a large dose into their lungs is lower. Of course, in a contained building, without dilution, without a lot of fresh air coming in, the concentration of virus in the space could build up over time. Again, the issue is the amount that's there and also the time exposed. If you spend 20 minutes shopping in the grocery store, you're going to inhale a lot less from whoever's exhaling virus in that space than if you spend 8 hours working there. So this is, of course, the issue that we're concerned about in our school buildings is how much is being exhaled and how much is in circulation over time. Next slide, please. So one of the classic ways that industrial hygienists, that occupational health specialists think about preventing exposure is with this concept of the source and then the pathway and the receiver. And if you think about what most of the recommendations are that we're being given, they are focusing on the right-hand side of this picture. We're being told to wear face masks, we're being told to wash our hands, we're being told to maintain social distancing, right? So the face masks protect against droplets. They don't protect against the nanoscopic particles that become airborne. Those are so small that most of them go right through the cloth masks. The cloth masks protect other people from you. If you have the virus and you cough or sneeze, that cloth will stop the big droplets from going through. Social distancing puts us at a distance, so it's in the pathway. It puts us at a greater distance from the source, so that's a good thing because, as we said, the farther away you are from the source, the less of it is likely to reach you. But again, that's more true of droplets than it is of the very small particles. What we need is more attention to the left-hand side of this diagram. Now, the picture obviously is referring to a chemical process in a factory, but if we think of ourselves, people, as the source, and mobile sources too, and many of us potentially being infected without knowing it, then we have to think of every person as a potential source in the building. So how can we practice primary prevention and isolate the source from people who might get sick? So ideas that have been in use right now have been limiting the numbers of people who go into a building, having staggered entry and exit times so that people aren't all near each other at the same time. Obviously, as we were saying, increasing ventilation. We need to be sure, though, that HVAC systems, if they're present, if there's a functioning ventilation system, that it supplies clean outdoor air, that it isn't just recirculating the air within the building over and over and over again. In a lot of schools and university buildings that are old and which don't have good ventilation systems, they may not do a good job of filtering. It might be possible to put in better filters that take out more of any circulating virus in the air, or we may need to go to other kinds of retrofits. We may want to put in germicidal ultraviolet light that can basically sterilize the air as it circulates through the system. We might even want portable HEPA filters, portable air cleaners in the rooms, perhaps near the students, or multiple ones in a room to reduce the amount of virus in circulation. So different solutions are going to be feasible, practically and economically feasible in different situations. But what I really want to emphasize is that we all need to be asking for information about the ventilation in our school buildings, in our workplaces, and to ensure that that's being part of the control strategy that's planned, regardless of where you work. Next slide, please. There are a huge number of big picture issues that need our attention, and we've been finding at UMass Lowell, when we raise these issues, that the administration has a natural tendency to make a distinction between the technical issues and what they refer to as the HR issues. But the reality is that all of these concerns about personnel policy and whether people feel safe reporting symptoms to the employer, whether there's paid sick leave, whether there's whistleblower protection, if those things aren't in place, then the whole system can fall apart, no matter how well you've attended to the technical details of tracking who goes in and out of the building. We need to have enforceable guidelines, and we need to have a meaningful monitoring system that is looking for all the ways that things can go wrong, finding and catching those things in real time. And that means that all of the bargaining units have to be represented in the evaluation process, because otherwise there's no way for a centrally located administrator to know about the ways that things might be going wrong. Okay, I'm going to stop there so that we can move on to discussion. Thank you very much for your attention.